A growing threat: antibiotic resistance in Somalia. Somalia faces a growing crisis. Antibiotic resistance, this means infections, once easily treatable, are becoming harder to fight. Antibiotics, once miracle drugs, are losing their effectiveness. This poses a serious threat to public health in Somalia. Antibiotic resistance is a complex problem with multiple contributing factors. Years of conflict and instability have weakened Somalia's healthcare system. This has created an environment where antibiotic resistance can thrive. The consequences of inaction are dire. Untreatable infections can lead to prolonged illness, disability, and even death. The situation demands urgent attention and a multi-pronged approach to combat it. The international community must also play a role in supporting Somalia's fight against antibiotic resistance. The open door: unregulated pharmaceutical imports.
One major driver of antibiotic resistance in Somalia is the lack of quality control over pharmaceutical imports.
Many antibiotics enter the country without proper scrutiny.
This opens the door for counterfeit and substandard drugs to flood the market.
Counterfeit antibiotics often contain incorrect dosages or inactive ingredients.
This makes them ineffective in treating infections.
This also contributes to the development of antibiotic-resistant bacteria.
The weak regulatory environment makes it easy for these substandard drugs to reach patients.
This fuels the cycle of antibiotic resistance.
Addressing this issue requires stricter import controls and stronger regulatory mechanisms.
The situation with pharmaceutical imports is really concerning.
Without proper checks, it's so easy for counterfeit and substandard drugs to enter the market.
This not only makes treatments ineffective, but also accelerates the development of resistant bacteria.
We need stricter import controls and stronger regulatory mechanisms to tackle this issue effectively.
A scarcity of expertise: the pharmacist shortage. Somalia faces a severe shortage of qualified healthcare professionals, particularly pharmacists. This shortage has crippling effects on the fight against antibiotic resistance. Pharmacists play a crucial role in ensuring the appropriate use of antibiotics. This expertise is essential in preventing antibiotic misuse and slowing down resistance. However, the lack of trained pharmacists in Somalia means that many people have limited access to accurate information about antibiotics. This often leads to self-medication and inappropriate antibiotic use, further fueling resistance. Investing in pharmaceutical education and training is crucial to address this shortage. The absence of strong government regulation and oversight further exacerbates the problem of antibiotic resistance in Somalia.
A lack of clear guidelines and enforcement mechanisms creates an environment where antibiotic misuse can thrive.
Without effective regulation, the sale of over-the-counter antibiotics goes unchecked. This allows people to access these powerful drugs without a prescription or proper guidance.
This practice significantly contributes to the development and spread of antibiotic resistance. Establishing a robust regulatory framework for pharmaceuticals, including antibiotics, is essential.
This framework should include licensing requirements for importers and distributors, as well as strict penalties for those who violate the regulations. The human cost of antibiotic resistance in Somalia is undeniable.
Fatima, a young mother, shared her harrowing experience. Her infant son contracted a severe respiratory infection. Despite multiple courses of different antibiotics, his condition worsened.
The bacteria had become resistant, rendering the treatments ineffective. Her story is not unique.
Countless Somalis face similar struggles as antibiotic-resistant infections become more prevalent. These stories underscore the urgency of addressing this crisis.
These stories highlight the human toll of this crisis and the urgent need for action. Addressing antibiotic resistance in Somalia requires a multifaceted approach.
Strengthening pharmaceutical regulations, improving surveillance of antibiotic use, and promoting public awareness are crucial steps.
International collaboration is also essential. Partnering with global health organizations can provide technical expertise, financial resources, and essential medications.
By working together, we can help Somalia combat this growing threat and protect the health of its people. The fight against antibiotic resistance is a global one.
Somalia needs our support.